We're now going to have a look at some of the daily activities that can cause some of the worst problems in terms of injuries and pain. So when performed incorrectly with the wrong posture, there are quite a few daily activities that can result in shoulder strain, neck tightness, tension, headaches, knee pain, and lower back stiffness. It can also affect your sleep. So we're just going to give you some tips on how to perform these daily activities correctly to reduce any pain and prevent any injury. So when lifting baby from the floor, it's really important that you don't lean forward and lift using the muscles of the back. This can cause back strain, it can cause the muscles to spasm, it can worsen any sciatic pain that you might have, and it's putting a lot of strain on the muscles and the joints of the back. What you need to do is make sure you have a strong base, and you need to bend down like almost in a squat position. So you've got your braced abdominals, your bottom's back, your knees are bent, your chest's high, and as you lift baby up, you're bringing them in close to the body before you stand up, so that you're not putting any additional strain on the back. So whether it's a change bag or just a handbag, carrying a bag on one shoulder all the time can significantly affect your posture. And how it does that is you tend to drop the shoulder and the rest of the side of the body in which you're carrying the handbag. So on this photograph, you can see the handbag is on the left side of the body. So the weight is pulling the left shoulder down, and what happens is the body tries to counteract that by lifting the left side of the pelvis up. You can see that the left leg is locked at the knee and the right leg is bent. Again, that is creating a shift in the pelvis laterally, so it's moving to one side. So the muscles down the left hand side of the body are shortening, and the muscles on the right hand side of the body are lengthening to compensate for this uneven weight. Now over time, if you carry the bag on the same side, these muscles are going to start to stay in this position, and that will become your everyday posture. So having tight muscles down one side and lengthened on the opposite side can result in pain, especially lower back pain, and can affect your mobility to be able to carry out everyday tasks. We recommend using a rucksack so that the weight is centralised in the body and is spread out with even weight across both shoulders, and you're able to brace your abdominals to keep your torso upright. When we're changing baby's nappy, it is so easy to just grab the change mat and plonk yourself down on the floor and do it as quickly as possible. We've all done that, and sometimes it's just the easiest thing to do. However, doing this on a regular basis can again significantly affect your posture and can cause pain in the lower back area. So you can see from the image, the posture we talked about earlier, that rounded upper body, those shoulders starting to come in, the forward head position. This position's weakening the core and putting a lot of strain on the lower back. Actually, just performing this task for 3 or 4 minutes, however long it takes to change your nappy, you will start to feel the tension in your neck and your lower back. What you should try and do is try and change the baby on a higher surface so that you're not having to bend over and put strain on the lower back, that you can work at hip height or slightly higher. So carrying your baby on one side is often an easy thing to do because it frees up your opposite hand to be able to multitask as us mothers do. Now, I was terrible for carrying my daughters on the left hand side, and it actually created a multitude of problems for me in terms of posture, tightness, pain, and affected me getting back into training again because I had to totally restore my body back to the beginning before I could start progressing with exercise. So when you hold a baby on one side, it's a bit similar to having a change bag. You can see here, the baby's on the left hand side, and so the left hip is pushed up to support the weight of the baby. So again, shortening all the muscles on the left hand side of the body. The left knee's locked out, putting a lot of pressure on the knee joint, and the left shoulder is dropped down, so really creasing together all those muscles on the left hand side of the body. What happens on the opposite side is the right shoulder becomes higher, the right hip drops, and all the muscles down the right hand side of the body lengthen and almost become inactive. So this causes a big shift in the position of the pelvis. It can cause the glutes, so the big muscles of the bottom, to become weak and inactive, and can create a lot of pain and tension around the muscles of the lower back. So how you should carry baby is in a front position so that the weight's evenly distributed. You can brace your abdominals, support your upper body. You haven't got any tilt in the pelvis, left or right. Your shoulders are even, and you're activating your glutes to stabilise your core. So carrying a car seat, we've all been there where we've had it hooked on our arm like a handbag and then had to stop every few minutes to give your arm a shake, or change sides, have a little rest, because in just a few short moments you can feel the muscles start to ache and fatigue on whichever side you're carrying it. So as you can see on the left image, we've got that typical handbag style clutch. So the car seat's just sat in the crease of the elbow. Again, we're having to put a lot of pressure into the left hand side of the body, all those muscles, to try and stop ourselves from tilting over, and that creates a lot of tension in the muscles of the lower back. It shortens those muscles, your shoulder begins to drop, and like with carrying a baby or carrying a change bag, the opposite side of the body then overcompensates and lengthens, and again can create quite a lot of pain. If you look at the opposite photo, you can see straight away that the posture is so much better. We haven't got any tilt to the left or the right. Hips are central, the pelvis is in a neutral position, abdominals are braced, the knees aren't locked down, and we've just got a hook through the car seat and the hand gripping the car seat. So it's resting in the crease of the elbow, but the elbow isn't supporting the car seat. This is a much better way of carrying a car seat to not damage your posture, cause pain, or possible injury. When you're lifting a child from the floor, it can put so much strain on your lower back. What happens is, when you lift something, the pressure that exerts onto your spinal discs multiplies about 3 to 10 times of whatever it is that you're lifting. So if you're lifting a 10-pound child off the floor, then you're potentially putting 100 pounds worth of pressure onto your back. So if you look at this first picture, leaning forward, with the arms extended and the child far away from the body, you're putting so much pressure on those discs of the back as you lift the baby onto your lap. What you should do is you should kneel down, so you've got one foot flat on the ground and a knee on the ground, so that you can drive through the foot and use those big muscles of the legs and the glutes to lift the child, bring them in close to your body, and then sit down. And this significantly reduces the pressure and strain on the lower back. So if you think you're going to be feeding your child possibly every hour, every 2 hours, every 3 hours, every 4 hours, it's a lot during a 24-hour period. And so it's really important that you get the right nursing position. One, it creates a better experience for your baby and also for yourself. If you're going to be in this position for a period of time, it needs to be comfortable. So whether you're breastfeeding or bottle feeding, it's really important that you try and get an upright, neutral posture. So if you look in the first image, we've got that hunch back developing, we've got that rounded upper back, rounded shoulders, a lot of pressure in the lower back. You're weakening the glute muscles, the bottom muscles sat in this position, and you're creating a forward head posture. You're weakening your abdominal muscles, potentially making any abdominal separation worse, and over a period of time this is going to become uncomfortable and you will start to feel pain when nursing your child. What we should be looking to do is having that good seated posture. So the bottom is against the back of the chair. You've got a neutral curve of the spine, so it's not flat back against the chair, but it's not curved forward. Your upper back is in contact with the chair. You've got braced abdominals, your shoulders are back and down, and if you need to, you can get some pillows around you to prop up your arms to keep them comfortable. This is a much more effective position for feeding your baby in terms of reducing pain, reducing the risk of injury, and a more comfortable experience for you both. So taking baby out for a walk in the pram is one of the best ways for you to get out and get some fresh air, for baby to get out and get some fresh air, and also to start getting a little bit of exercise, getting that heart rate up, getting those muscles working. And so it's really important that from the start you're using a really good posture when pushing the pram. Otherwise you'll start to develop a bad posture, and you'll do this over a period of time, and that will become the norm. And again, like we said, that's when you start to feel those niggling pains if you've been walking for half an hour or so. So we're going to look at the correct posture for pushing a pram. So we want no creases in the wrists. So during pregnancy, it can be quite common that you suffer with wrist pain. Some women develop carpal tunnel syndrome. And so we need to make sure that when you're holding the pram, you've got nice, strong, fixed wrists. You need to have your hips near the handle, so you don't want to be too far away like the first photograph. So again, you're leaning forward, and that's putting a lot of strain in your lower back. It's also causing you to have that forward head position, so creating tension in the upper back and around the neck. You want your chest up, pointing forwards, shoulders down, so again, we're reducing any of that tension in the neck. And you want your head looking forward on the horizon. When you're lifting your baby in and out of the cot, it's really important that you keep them close to your body. If you extend the baby far away from your body, so at arm's length, you're creating a lot of pressure and tension in the muscles of the back, just trying to stabilise you in that position. So you don't want to lock your knees out, you want nice soft knees, a fairly wide base, and if you need to, lower the side of the cot down so that you're not bending from the back. Or if your cot's fixed like this picture, then you can use a step so that you're higher up and able to get that good hinge at the hip and not bend from the back. So the worst thing that you can do when you're putting your baby in a car seat or out of the car seat is have both your feet flat on the ground and really twist your upper back and rotate with that weight of the baby and twist into the car to put them into the seat. It can damage your knees, your lower back, your neck, your shoulders, elbows and even your wrists. So what's really important that you do is step one leg into the car and one leg out of the car so that you've got a really strong wide base. That's going to take the pressure off your back, and you're going to make sure that your body is positioned facing the car seat so you've not got that twist of the hips while carrying a heavy weight in front. This is going to be much more effective at getting baby into the car seat in a safe position without putting strain on you, causing pain, and again, possible injury. So these little tips will just help you on a daily basis to reduce the risk of injury, reduce pain, and they'll also support the exercises that you're completing as part of the monitoring method.